Great. Well, thanks to everybody for joining. Welcome to our healthcare session. I'm going to be focusing on healthcare trends for 2022 and beyond. I'm Jennifer Stango. I'm the Vice President of Industry for Argano. I'm a former CFO. I've been in the healthcare industry for about 15 years, mostly focused on the ERP, EPM. We also do patient engagement and have some solutions for that. Julia, would you like to introduce yourself before I start?
Absolutely. I'm Julia Stump. I am the Strategic Healthcare Director for ArganoArbela. Been here a few months. Prior to that, I was with Oracle for 6 years and have had the distinct privilege of working with financial professionals such as yourself for about 20 years, really talking about strategy and applications solutions. So looking forward to working with you.
Great. So a little bit about the impact of the pandemic or COVID-19. What we saw and what's kind of the catalyst for what we're going to talk about today is the pandemic had numerous impacts on healthcare. The first one being is deferred care. Most people postponed elective surgeries, didn't go to their primary care, didn't do a lot of their annuals. There was really caused a decrease in healthcare spending in fiscal 2021. There's a big backup of that that's about to hit the market, which we'll talk about a little bit later. COVID-19 really eroded margins in healthcare between the free testing, the free vaccinations, the extended hospitalizations. What we've seen in the last 18 months is the profit and loss statements, margins are just crazy for healthcare. People are trying to figure out where the trends are at, trying to reevaluate their financial statements. Worsened self-care is a big catalyst. So there was like a lack of exercise. People were in their homes for 18 months, which caused a lot of mental health issues. Substance abuse is at an all-time high. Mental health right now is the largest crisis that's hitting the United States. Most people don't have access to it. There's not enough mental health providers. Actually, you cannot get a pediatric or adolescent bed if you have a child right now that needs psychiatric care. It's just not available because the market is so impacted. We also saw an uptick in poor nutrition. Given that people could not eat out or that the grocery shelves were empty, a lot of people took to eating fast food. So when you combine the lack of exercise, the poor nutrition, the mental health issues, the substance abuse, we're going to see a very large upturn in care. And so trying to figure out what that model is going to look like. The pandemic also brought to light the imbalance of care. What they found out, and there's a lot of studies on this, is Medicare beneficiaries had a 40% or higher chance of hospitalization because they didn't have access to specialized care. We saw that even more in rural areas, that people that were not in metropolitan areas could not get access to the care that they needed. The next thing that really was interesting is that it was decreased emergency room visits. Most people did not want to go to the ER. They were afraid of contracting COVID. They knew a lot of people were at the ERs trying to seek COVID care and that the hospitals were burdened. So what they embraced was telemedicine. We saw a really large impact on teledoc and other things like teledoc. Retail clinics like CVS with their Minute Care, they really took over a lot of, I have a stuffy nose, I'm having allergies, where you could walk in and deal with that Minute Clinic. And then also non-traditional forms of healthcare took off. So people were trying to find things like chiropractic appointments if their back hurt. So instead of going to a prescription, they were trying to find something else, whatever that was for them. I think this is going to continue. Most people don't want to go back to the ER now that they've actually found the way of getting treatment that doesn't involve sitting in the ER for 4 hours waiting to see a doctor. The pandemic had a gigantic impact on supply chain. When you think about it, how many times did we see in the news that there weren't enough ventilators? There wasn't enough personal protective equipment to go around. We saw nurses that were having to reuse masks because they could not get the masks. And so they're normally one time and then throw them away. So what is happening is healthcare and life sciences are spending a lot of time and a lot of energy trying to figure out how to do predictive modeling to address the supply chain issues. There's an interesting Frost survey that was done that said that had they collected the right information, meaning that when people were going in and getting tested initially for COVID, it was lacking things like address information, zip codes. Had they collected that, they would have been able to have the ventilators at the right place at the right time. So I think that there's going to be a very big renewed focus on supply chain. Now, the other thing that really happened when we talked about this decreased emergency visits, telemedicine came. And so when telemedicine, it's that whole work from home option. How many people were calling their primary cares and their primary cares were not in their office? So it brought to light all of these needs that healthcare has for investments in remote workforce. Like, how do you get cybersecurity? Because the last thing we want to do is be on a Zoom or a Teams call with our doctor and have someone else pop up when we're addressing our health issues. So cybersecurity, work from home for a doctor, how do you get them a tablet, a phone, something that actually has that ability to interact with their patient? Administrative, most people were actually working from home. We're seeing this more in clinicians. And then also that whole concept of remote training. Healthcare did not stop. So we saw the COVID vaccine come out. And of course, you need training on how to administer it, how to talk about it as a pharmacist or even a clinician, and then address the side effects for it. So all of that all of that training that used to traditionally happen in a healthcare setting was now moved to remote. So the pandemic had numerous impacts. I think the biggest impact that we saw was providers. Provider satisfaction is at an all-time low. There's a lack of new talent entering the market. We all know this, that there's always been a shortage of clinical staff, but now there's definitely a shortage of clinical staff. There's not enough people to cover the shifts, not enough doctors, not enough nurses. People are doing more hours than they've ever traditionally done. When you think about traveling nurses are making more right now than they ever have historically. It's great they came in and they solved the health crisis, but it's definitely put a tax on the healthcare providers, the hospitals, the insurance companies, because the cost has gone up so dramatically. I think physician dissatisfaction, when we talk about it, there's all of these other things that are kind of getting left out in the nebulous, right? And when I say that, doctors are having a hard time with patients. They don't want to come in, regardless of what your beliefs are. People don't want to be vaccinated. They're not following the treatment plans that are being put out there. And we've also seen some disparity to where, given the fact that the healthcare system is so taxed, as a new patient, I want to select who my doctor is. So maybe I'm a female and I want a female doctor. I can't get that right now. And so a lot of doctors are having issues because patients are saying, I don't want to work with you. And that could be racial. It could be that they want to deal with a US citizen. It could be gender. So physicians are having a really hard time addressing patient needs because they're just refusing to see that doctor for whatever reason. Education, doctors, nurses, we know they have to keep their licenses up. There's all of these seminars and conferences that they used to go to. All of those education opportunities just haven't really existed over the last 18 months. So they're not getting the feedback that they need. The shortage of IT professionals, this is also causing them a ton of problems. Electronic medical record systems, not only was the pandemic going on, but I live in Southern California. We saw one of our largest hospital groups actually have all of our patient records go on hold, and it took 6 weeks to get them released. Cybercrime came in. The IT professionals weren't there. They had a proprietary EMR system. So a ton of things happened. Doctors could not treat patients. They're trying to get their prescriptions renewed. Doctors were getting yelled at because the health records were locked. So the IT professional shortage definitely had an impact on them. And then I think everybody's talking about this, but there is this gloom and doom in the market that said that there's going to be this gigantic impending turnover. I think this is definitely going to hit healthcare. There's a lot of dissatisfied clinicians. They're going to be out looking for new jobs. And so how is that going to impact your healthcare organization? So this is just going to continue to happen over the remainder of this year and into next. So where do we see the 2022 opportunities? And so it's not just 2022, it's also beyond, because there's a lot of things that are happening in the market that are going to impact you. So the near-term opportunities, what we see are kind of getting addressed right now, and we're going to get it addressed probably in the next 2 years. That real-time data and reporting to address deferred care. Most people did not go and get their annuals. Things like mammograms, physicals just weren't done. So how are you going to collect that data? And then we know when people don't do their normal maintenance, their normal care, it's going to actually increase costs because you're going to have worsening health. So how are you going to target those patients, target those people that deferred their care? Whether that was an elective surgery, whether that was just the reoccurring appointments we're supposed to go to. So this is a near-term opportunity, is looking at all those patient records, saying that there's an elective surgery coming up. And then are we going to have the right people, the right supplies? We talked a lot about this, but telehealth, just not for I have a runny nose, but telehealth for mental health. It's the largest growing market right now in the United States. Healthcare is trying to get this addressed because we all know when people are having mental health issues, it also manifests itself physically. People stop exercising, they go to substances. Telehealth in this industry, in this space, is going to be it for 2022. We talked a lot about this a little bit earlier, but it's that whole racial, economic, elderly care disparity. Most of the studies are saying rural areas did not have access to specialized care. Elderly care, they could not get into their doctors for a myriad of reasons: lack of transportation, fear of COVID. How are we going to treat our elderly population and get them what they need? Because on top of it, elderly care will not go to telemedicine. We've really been, as a market, trying to figure out how to get them back into healthcare, how to get them the services, but they don't walk around like with an iPhone or whatever it is that we do. They're not as comfortable logging into a tablet and talking to a doctor virtually. Provide diagnostic at-home alternatives. I think what I've seen, and a lot of you probably have seen, is you can walk into your CVS, your Walgreens, your Costco, your Sam's Club, and pick up a COVID testing kit. It's the first time ever we've been able to really test ourselves outside of traditional diabetes for a disease. This, they're saying, is going to be a big trend, is that whole concept of at-home testing for, when you think about irregular heartbeats, you name it, we're going to be able to test ourselves more at home. Virtual exams. I think it's closer than what we want to talk about, but if you're a big Star Trek, Star Wars fan like I am, that's the whole concept of a doctor that is a hologram talking to you and treating your symptoms. We're seeing this become more and more with Teams and Zooms, is that you can get that virtual exam, but can you take it a step further? And when I say a step further, it's that concept of a digital app or a smart device. I wear my Apple Watch. My Apple Watch now has the ability to do fall detection. Someone that sits for a longer period of time has a higher fall incident. So they can now take that information and start gathering it and figuring out, like, from my heartbeat, can I do an EKG? It will also give me a high heartbeat warning. So smart devices, we've always thought about it more from diabetes and some other things. It's now becoming more and more apparent in the market that we can use digital apps and smart devices to provide care. Virtual exams are already happening, and virtual consultations are happening. I live in Southern California. Maybe I have something that I need a specialized care, so I can go into my primary care. We can set up a Teams session or a Zoom session, and we can have a conversation with someone out of the Cleveland Clinic that can help diagnose it with the patient that's very similar. They can see all of my records. So these at-home alternatives, virtual care, is just going to continue to grow. With how this impacts the traditional CFO and accounting, is we talked about emergency room departments are an all-time low. What we're seeing is that those dollars and those costs are now getting more associated with virtual care. So being able to analyze that data, look at financial metrics in a new way, provide those actionable insights. Like, do we need to staff up in these different places? Do we need to start addressing new suppliers? What is this going to look like? Doing all of those what if analytics scenarios is going to be very meaningful when we try to figure out where the new target for revenue and the new indicators for patients. We talked a lot about supply chain. I talk a ton about supply chain with healthcare. What we're really seeing is that there's increased storage, and I'm not talking about increasing storage in your materials management department. What we're talking about is people are actually looking, healthcare organizations are actually looking at having an off-site facility to store overstock. And is that building that facility? Is it a capital investment for you? Is it going and finding another facility that you can move your whatever it is into it? And are you going to enhance it? Does it need cold storage? Does it need security? So storage is not materials management like downstairs in your basement. Storage is where are you going to have your overstock? Where are you putting all of this material? Because the concept of just in time in healthcare, given what happened with the pandemic, is going to be going away. And I think in the next 5 years, we're going to see a lot of people trying to figure out how to do shared inventory models. When we talk about new models, I think like a lot of hospitals I go to, they kind of have that McKesson, right? Like that McKesson is their primary. I know there's other vendors out there just using it as a scenario. McKesson is who they go to, but people could not get masks. People could not get gowns. They could not get gloves. And so what we saw and what we're going to continue to see is that they started developing connections with backup suppliers, smaller suppliers that are either in the United States or in offshore. So if this happens again, and I don't know if it's an if or when, but if and when it happens again, instead of being out of stock somewhere, I now have other places I can go to that are going to be able to provide me with the materials I need. It just didn't happen with the pandemic. We saw this when there was a lidocaine shortage. I think it was about 5 or 6 years ago where there was this big hunt to find the lidocaine when Puerto Rico got hit by the hurricane. These whole concepts of backup suppliers and alternatives, it's not new. It's just something that's really getting focused on of how this should never happen again. Develop that end-to-end view of supply chain. This one, I mean, this has been big in healthcare for me for at least the last 10 years. Clinicians, consumers always have preferences. But what we've seen is given the shortages is how do you ensure that right care at the right time, right place scenario, especially now with the virtual care models. I mean, if doctors want to do a procedure and maybe they're going to be doing it at a location they're normally not at, is how does that follow that clinician? How do you know that someone's allergic to iodine, as an example, right? Like that whole end-to-end view of the supply chain from the time that we schedule a procedure to the time that it's actually done. This one's been big for a while. I think it's going to get really, really big over the next 5 years. The adapt to care at home. So virtual care, right? Everybody is trying to figure out how to do it. But what we're seeing is people are exploring those partnerships with retailers. So as Teladoc, as an example, I might call about a sniffly nose, and they might actually tell me to get into my primary care. I can't because they're so backlogged. So what they're doing is they're now partnering with retailers, that whole concept of the CVS Minute Clinic. So as a hospital, could you do the same thing? Could you partner with a Minute Clinic for CVS to where maybe you can't get them in, you don't want them in the emergency room, but you're partnering with them for that care at home model? When we talk about care at home, there's this whole new concept of logistics. Hospitals are not used to having to ship things out. Healthcare providers are not used to having to ship things out. Could they use those retailers to ship things out? Instead of increasing their storage and having an offsite facility, is that concept that they're partnered with somebody else? When we start thinking about that, it's a whole new trend. And could you utilize artificial intelligence to look at what the logistic trends are? And how are you going to serve those dispersed at home care settings, right? On top of it, could you use that artificial intelligence, that whole machine learning, to look at what happened during this pandemic and plan for upcoming pandemics or disease planning? Like the flu is supposed to be really bad this year. Is there something that we can use to look at those trends? What we're going to see next in healthcare is that whole concept of virtual care centers. A few hospitals have already tried this, where there's no waiting rooms, no hospital beds. It's all virtual hospitals group. They're providing almost near-time continuous care without actually seeing someone. So when we start thinking about investments, how do you plan for this? What is the capital cost behind this? These are the things that we need to start figuring out what the models look like, the financial models. There's a whole bunch of new technologies that are being piloted. We talk about smartphones and tablets. So being a doctor and now being in a virtual care setting and having a conversation like this, and do I have that whole longitudinal record, that whole patient record on my smartphone at this point? Is that something that's provided by the hospital I work for, the healthcare facility I work for? Is that a tablet? What does that app look like? 3D printed hip and knee replacements. This is happening right now. But instead of having that medical kit that normally has come over from some type of ortho company and you have it stored away and you only pay for it when you use it, that model is really dissipating. What is happening is people are buying medical grade 3D printers. And so when I go in and I have a hip or a knee replacement or any joint replacement for that matter, or even if you're a dental facility, you can now print crowns the same way. But that whole concept of when I'm having the procedure done is I can print it as they go. This is going to be a capital investment. It's also not just the actual product, that 3D printer. It's also training people on how to do this because it's a new skill set for medical professionals. Health bots for administrative tasks. Interesting studies were done during the pandemic. And one of the ones I saw was for radiology groups. What they saw is women that wanted a mammogram, as an example, there were certain times that they wanted those appointments. And when they used a health bot versus calling into a reception or scheduling, they were able to gather the clicks, meaning that when I was looking for a time spot, I was looking for when my kids were at school. I was looking for early morning. I was maybe looking for lunchtime, or I was looking for after dinner when my kids went to bed. They were able to open up 3,500 extra appointments just by looking at the data that they gathered. So think about that revenue stream to you. That health bot gathers information, you put AI or machine learning against it, and now you're able to have the right care, right time, right place. We all know clinicians are not happy right now. So what we're seeing a lot of healthcare move towards is human-centered design. How do you engage a clinician and how they want to do their job? Is that remote? Do they still want to be on site? Is it something that's virtual? How do you offer to them the remote work opportunities that they're looking for? Are they a specialized skill set? Can you share them across multiple of your facilities now that they can be remote? Human-centered design for clinicians, when we say that, it's also that interaction. What do you want to do, Julia? Like, what your goals are? How do you want to provide care? This is where recruiters are really kind of changing their messaging towards the clinicians, the doctors and nurses. Remote, we talked about virtual training. As a healthcare organization, how are you going to providing that virtual training to them? How are you going to make sure that they're getting what they need to do their jobs in today's world? And then providing new apps for effective workflows. Most clinicians, as we know, spend more time looking at a medical record and kind of figuring out where they're going. A lot of healthcare companies are making investments in that whole concept of a longitudinal record. So we know what the next best action is or the workflow. We know that Julia's coming in for this. We know what type of appointment she needs and what type of follow-up that she needs. And then lastly, transparency and consumerization of healthcare. The No Surprises Act takes effect January 1st, 2022. Hopefully that's not a surprise. That means that we're supposed to know what exact cost is. So if I'm going to go have my tonsils removed, I can't get a surprise bill 6 months after the fact because someone didn't know that it was going to be blah. All of that's supposed to be inside of my treatment plan with the cost. So looking at what something has traditionally been billed for, what the costs associated with it, to make sure that we're properly billing someone, because this can negatively impact margins if we can't retroactively bill people. And with that is how do you come up with that patron-centric technology that's going to improve the convenience and the speed of actually letting them know what the actual cost of the procedures are going to be. So with that, I'm going to turn it over to Julia. And if you have any questions, I guess we should have said this. If you have any questions, please let us know and you can put those in the chat and we'll respond to them as we're going.
Thank you, Jen. Can everyone see my screen?
Yes.
Excellent. So welcome again. Thanks for joining us for just a little bit today. Again, I am with ArganoArbela. I'm the Healthcare Strategic Director there. And today we're going to talk a little bit about just a quick glance back into the aftermath of the pandemic, looking at some digital transformation opportunities, as Jen mentioned, looking at just a short recap of 2021 and some projects that we work with organizations so you can get some ideas of perhaps comparative things that you've done and what you might plan for 2022, and a few items to look at for preparation, tools for you for preparation for 2022. And then at the end, just a little bit of information specifically just for you. So ArganoArbela, I realize some that maybe you may not be familiar with ArganoArbela, formerly known as Intrel. We have implemented only Oracle solutions for over 24 years. And we actually have the most ACE directors on staff of any enterprise performance management partner that Oracle has. We've been awarded Partner of the Year several times. And we have really the most experienced staff and have the most experience implementing EPM, looking at over 150 plus EPM implementations and multiple first implementations, including S-based cloud services, planning and budgeting cloud services, and financial close and consolidation. So been around the block a few times, and actually our CEO, Edward, was the very first Oracle S-based director. And he has a lot of educational webinars for you guys to actually go look at, and I can certainly send you some links for that. But I want to first of all look at, I know this is painful as we look at these numbers, but first of all, I want to congratulate all of us here for surviving the epidemic of 2020. I mean, it was not easy. I'm sure we each have of our personal stories. I know these memories and these numbers are painful, but the idea is to think back, reflect back, and let's not forget. And how can we possibly better prepare ourselves for what's next? And looking at what's next, closing out 2021, just a kind of a recap here. As we approached 2021, of course, the Delta variant came out, right? Johns Hopkins report just came out October 29th. It confirmed that the cases of COVID now have passed 245.5 million globally. And this report also shows that reported cases are up despite increased vaccinations. So it's not over yet. We still have some challenges ahead of us. And I think one thing that all of us can relate on the phone is the expenses are continuing to rise, right? They're still on an upward trajectory. So as we're aware, we also have staffing challenges, right? So who doesn't, right? Anybody out there that doesn't, I'd like to hear that. But what can we do? So how can we prepare and reflect back on 2021 and help us to prepare for 2022? So just a quick recap of 2021. Just again, I want to go over projects and what we spent time with our clients in 2021 to give you an idea of where we've spent our time. In 2021, a survey came out, and 54% of healthcare financial professionals that surveyed said that their tools and technology did not properly prepare them adequately to support financial tracking, management, and reporting. So we know what that meant to us, and each of us has our own pain to share about that. So what we're going to look at is how we use tools to help our clients navigate through 2021. So again, Oracle Enterprise Performance Management. Some of you may not be familiar with what it is. It is a conglomeration of the modules that you see, or the functionality you see here, including financial close consolidation, which we actually have a session, I believe, I can't remember if it's later today or tomorrow, on SCCS, strategic planning, capital planning, budgeting and forecasting, costing, and I believe we have a bit of a presentation on that as well. I think Delilah will be presenting that. Labor productivity, and of course, reporting analysis laying across that. So we're going to look at actually some snapshots and reports of some projects that we've worked on this year with clients. And another key functional that you might want to look at the bottom is enterprise data management. Again, having enterprise data management over across EPM, as well as being able to expand into all of your financial systems, as well as across the organization. We will actually have a session on EDM as well related to healthcare. Darren Polino from Oracle will present that during our solutions conference as well. So keep an eye out for that. So again, let's go on to some things that we've helped clients with in 2021. Annual forecasting, moving to rolling forecasting. Although many industries like manufacturing have adopted rolling forecasting years ago, healthcare would traditionally have stayed with annual forecasting. And during a 2021 annual survey, there was some interesting statistics. I knew that we were a bit behind, but didn't know that we were this far behind. But 23% of those surveyed say that they continue to use spreadsheets for budgeting. And only 12% of those respondents use rolling forecasts rather than annual budgeting. But during 2021, 59% of those respondents said that they will make rolling forecasting a priority in 2021. So we did spend a lot of time in projects working on moving organizations to rolling forecasts. So again, what are the benefits of rolling forecast versus annual, right? Being able to look at a frequent forecast versus, again, planning for the entire year. So you can have time span based budgeting. I'm looking at business driver based forecasting using current operational metrics. At times I'm sure we felt like we were just, flying by the seat of our pants, so to say, as the market changed and we tried to adapt to the things that the pandemic brought to our table. So being able to forecast quicker with increased transparency, with more actionable data, being able to give executives data quickly when they needed it. Instead of by the time you got the annual report out, executives were already asking for changes. So being agile, having access to real-time data-driven decisions for executives and for our organization. So that was our part. We also looked at S-base upgrades. A big key, if you look down in bold, the S-base. So again, what is S-base, right? So Oracle S-base, it's a multi-dimensional database platform and business analytics solution. Some people aren't aware of what S-base is, so give a short blurb there. Also called S-base cubes, the databases are defined by dimensions, which are hierarchical groups of members' data and organized into cross-sectional groups. So that's a bit of background about what S-base is. The background about how Oracle ended up with S-base. It was actually originally created by Arbor Software, which merged with Hyperion Software. So when I talk to most financial professionals, they're familiar with the Hyperion name. That was back in '98, and Oracle acquired Hyperion in 2007 and then marketed Oracle S-base in 2009. So that's the background of S-base. Bring it back to today, Oracle EPM, which is the cloud version of Hyperion, is built on that S-base platform. There are still a lot of our clients that are still on S-base and still on older versions of the The big push this year was really upgrading a lot of those organizations that were on older S-base versions, especially 11.1.2, whatever version you're on. I'm surprised at how many, even in the last few months that I've talked to our clients, have said they're not aware that the premier support of that product ends December 21st. So we've helped with upgrades. And we came out and partnered with Oracle with a solution called S-base as a Service, EAS. So what is S-base as a Service? It is, excuse me, it's the first fully managed S-base cloud solution. So what it entails is upgrading S-base to 21C, moving that to Oracle Cloud Infrastructure, OCI. ArganoArbela will provide managed services for 24/7 support. And then that is the culmination of that first fully managed S-base cloud solution. So OCI basically helps complete this journey to the Oracle Autonomous Database. I'm sure you've heard Larry talk about that. the integration of Oracle's complete infrastructure automation with Oracle Database 18c and its fully automated data center operations. So EAAS leverages machine learning, includes provisioning, patching, upgrading, online backup monitoring, scaling, diagnosing performance, tuning, and optimizations. So that is another program that we spent some time with our clients this year, and it is actually pretty busy this still as we approach that end of Premier support for 11.1.2 versions. Next, let's look at controlling expenses. We saw dollar signs expenses, and expenses continue to rise. So we're seeing more and more focus with our clients on being able to identify cost and profitability. We can look at procedures and patient department levels of data. So being able to define those levels of cost and profitability. And then being able to look at scenario modeling. So what if impacts as the market changes. So looking and operational changes. The major changes we had in elective surgeries and the ER and the OR, lack of resources, lack of supply. So being able to use scenario modeling as those market items change around us. So leveraging the automation. Now, when I say leverage automation, I've had clients tell me, oh yes, we leverage automation. We have lookup tables in Excel, or we have our IT group write programs that can automate. What I'm suggesting is take a look at enterprise performance management and the contents of what it can provide in a truly automated solution. There are all kinds of resources out on the web that Oracle has posted for you, and we can certainly show you that and connect. But really look at true automation where the solution has the engine behind it that it needs, not automating Excel worksheets. There's a next generation. So it's our responsibility to know what tools are out there and leverage them to the best of our ability. And then looking at clinical integration, being able to pull clinical data, and combine that utilization data at a rolled up level, and combine that with financial GL data, and then the ability to do things like create a fully loaded cost for CDM. So again, being able to really look at costs. And then being able to leverage EPM costing for peer contract management and reimbursement modeling, and looking at real-time EBITDA analysis at, again, the DRG, the patient physician charge level. So we're going to look at a little bit of what that looks like. A bit of a data model, just as an example, again, looking at pulling clinical data into EPM costing, as well as EPR data, and bringing that GL data in, and then marrying those two together, having a robust analytics platform. And so again, to help us aggregate and drill down from different resources to evaluate performance. What that brings to our table again is looking at service line profitability, and I'll show you a few of these sample reports just to give you an idea of what that looks like. Being able to drill down to DRG levels, and then being able to also drill down to charge code levels. So quite a bit of detail, even though again, you're aggregating and you're marrying the data from there. Look at cost modeling definitions and driver-based allocations to being able to look at, again, here we have case records, marrying that with general ledger cost and cost pools, and looking again at profitability. So let's look at a couple of screenshots to give you an idea of what that looks like. And I realize these are very fine print, so I've given you some high-level details here, looking at, again, this top level is looking at expenses, and then being able to look down here at service line profitability. And over to the left, looking at KPIs, looking at margins, the reimbursement percent, and a margin percent. So leveraging the tools behind costing. Next screen is looking at, again, cost-saving opportunities, summarizing here, expenses at top. And at the bottom left, looking at, again, service line, or drill down to, in the service line profitability down to DRG details. And then looking at the top report here, looking at physician cost analysis, and then being able to drill down to all the way to down to the charge code level. So that gives you just a couple of samples of, again, what costing can produce. And in the end, our long-term goal is interoperability, right? So being able to bring those costs from EPM costing, as an example, back into your data warehouse with the clinical data, excuse me, and then being able to integrate that with third-party systems. So being, again, taking that step and moving into the next step is with interoperability. As we know, again, that's our long-term goal. So 2022 and beyond, what's ahead, right? What tools can we use in 2022? So I just want to give you just a couple of quick glimpses into some tools and some concepts as we go through and prepare for 2022. The AHA, I thought was very interesting as it talks about this quote here, and talks about that we are in a unique position to improve patient experience, outcomes, and reduce costs. I know as we sit, you know, in our chairs and as finance people, we often wonder, well, how can I improve patient experience? We've already looked at being able to manage and help reduce costs, but also with better data. So can we be more conscientious, figure out what our responsibility is, and as the AAA says, can we transform patient care and prepare for future emergencies? So thinking of that, having a data-first strategy, what does that entail conceptually? Looking at a corporate-wide strategy, something we found that it is very pertinent is collaboration, being able to make sure you have executive sponsors, make sure you collaborate across the organization, and create an organization-wide data strategy, not just your financial data in a financial box. Now we need to obviously coordinate with clinical data. We also need to coordinate with HCM data and the HR world to be able to look at our workforce. So being able to collaborate across departments and organizations, looking for one source of truth, easy for me to say, one source of truth, being able to go back to the same organization or the same database and being able to pull the data out of one source of truth. And again, being able, that enterprise data management we talked about. Standardization is something I want to mention. You think that maybe larger healthcare organizations would have a better handle, but that's not necessarily the case. They have sometimes a lot of disparate locations, remote hospitals, CFOs for those individual hospitals that don't always necessarily approach planning and budgeting and data strategy in the same manner. So being able to standardize across multiple locations to produce true agility. And again, I'll go back again, I mentioned it again, enterprise data management, being able to manage that data across the organization. So when you have a department change or you have a position management change, what solutions need to be updated? Third-party solutions, Oracle, planning and budgeting, finance, what needs to be updated? And again, we have a session on that I think you would really benefit from if you're interested in that. Using data to manage capacity and allocate resources properly, right? We've all, managed to hear probably most or all of these questions, right? And Jen mentioned, needing ventilators, et cetera. So being able to manage data and be able to answer questions with agility. The No Surprises Act, Jen mentioned this as well. again, we're going to have to be able to provide a good faith estimate of charges to uninsured individuals. So can we provide that? Are we prepared? I believe it comes out January for the No Surprises Act, and what is next for us? Staffing challenges. I'd like to see anybody raise your hand here who doesn't have staffing challenges. If you don't, I'd really like to, to talk to you and find out your secret. But looking at staffing shortage, how can we prepare 2022? I saw this letter came out from the ANA September 1, and I thought it was interesting enough. As I mentioned, the president, Ernest Grant of ANA, wrote to the Department of Health and Human Services, on behalf of American nurses, I write to urge robust and immediate action to address the unsustainable nurse staffing shortage facing our country. This hit home to me personally. I think we probably all have a personal story when my daughter, who was a nursing director for a home health organization, and unfortunately COVID hit their facility. She's a mother of 2 little children, and she just worked a double shift, and she called me and said, "Mom, we have COVID." So she was isolated from her children. The staffing shortages, the weight that's on nursing staff, and ANA being deeply concerned that severe shortage, again, not just repercussions for the profession, but the entire healthcare system, and ultimately the health of the nation. So what part can we play? What tools do we have in our bag to really look at being able to assist with workforce planning? So EPM does have strategic workforce planning. If you haven't heard of it before, we can leverage that to plan the right skill at the right place at the right time. These are some of the key benefits, looking at being able to actually assess workforce skills and looking at your supply, looking at your operational demand, and then being able to do some scenarios according to that, and then be able to look at some gap analysis. So, and being able to create what if scenarios based on, again, the major workforce events that we've experienced and that we don't know will be ahead. So these are the building blocks of what strategic workforce planning looks like. Again, being able to assess workforce skills, calculate your workforce supply, excuse me, and then determine operational demand, and then analyzing, being able to lay across the what if scenarios or FTE planning and be able to perform gap analysis. So I just wanted to show you just a couple of screenshots of what workforce planning, strategic workforce planning looks like. Again, you'll be able to see these in detail when you get a copy of the presentation. But looking at assessing and ranking your skills, this looks similar to I think they call it a 9 box in HCM, if I remember correctly. But again, assessing what skills you have on hand. And the next screenshot is looking at your FTE supply. What do you currently have, right? Being able to look at the supply and break it down by different scenarios, jobs, etc. And after we've done both of those steps, then being able to look at the demand, what operational demand will you have? Will you be opening new facilities? Will you be shutting some? What will that demand headcount and demand FTE look like? So being able to prepare for whatever comes next and whatever the market brings us, being nimble. And then once we know the supply and demand, being able to perform gap analysis. Where do you lack? What will you need for workforce? So that's how we can play a part in, again, workforce management. And just to wrap up, again, we appreciate your time very much, and perhaps leave some time for questioning. A couple of things just for you. Interel has always been, and Edward Roski, our CIO, or CEO, pardon me, if anybody knows Edward, he's all about education. And we have different, what I call education station is how I refer to it, and that's because when I was with Oracle, it started a handful of years ago. When I first came into contact with EPM, I looked at Oracle training. I dug into everything that I could find. We had a few simple internal training sessions, but how I learned EPM was Interrel's YouTube channel. Excellent resources, excellent YouTubes. Go and find out if there's a subject that you're interested in. Go to Interrel's YouTube channel. We also always have monthly free webinars and conferences. Always willing to share those. If you'd like to get on a list, email me, and we'll make sure that you get those invites for those webinars and conferences. And several published books. I believe it's 11 or 12, if I remember correctly right now. But we have published books that are available for purchase, and ones in the raffle at the end. So we're also always looking for healthcare executives such as yourself to be able to pay it forward. We'd love for you to help join those webinars and conferences and help us to present. If you've implemented something that's successful, we want to hear those stories. We want you to share with us, and again, help to pay it forward and educate the rest of the world. Also, Jen and Dina, I believe, is on as well. And I will be putting together regional healthcare groups to not only talk about best practices, but also talk about market trends, as well as technology tools that we can implement. So that will be new this year. And then Oracle partner programs. We're working on an EPM template, as well as I mentioned the EAAS program. Again, that upgrade partner program that we're working with Oracle. And then last but not least, we will be having a post-conference raffle. So you will be sent an email to participate in this raffle. You will get a Solutions 21 t-shirt. I think that was shown at the very beginning of our session. You'll receive a $25 gift card, as well as one of Edward's books, Look Smarter Than You Are with Oracle Planning Cloud. So please be sure to enter that raffle, and thank you so much for attending.